Hey, happy Thursday. How y'all doing? My name is Jane Northrup, and today for pH Awareness Month, I am going to talk about diagnosing pulmonary hypertension. And so, to determine if you have pH and what type, which I will talk about in an episode coming up, your doctors may run some of these tests. So the first thing would be blood work. So the blood work can check your oxygen levels in the blood, observe liver and kidney function, can identify if the patient has collagen vascular disease, thyroid problems, infection, HIV antibodies. One test is the BMP, and that it stands for brain natriuretic peptide. I think I pronounced that right. Which helps assess the strain on the heart, and may also be used to monitor response to treatment. The next test would be a chest x-ray, and they can reveal an enlarged heart, enlarged right ventricle, or the pulmonary artery. Can also show signs of emphysema or scarring, which is interstitial fibrosis of the lungs. The next test would be an electrocardiogram. It checks the impulses of the heart. The electrodes are attached to the patient's skin, and the recording of the impulses are made. And this test alone is not enough to diagnose pH. But your doctor will also perform one or more additional tests along with that test. The next test would be an echocardiogram, or just an echo. Electrodes are placed on the skin, and a sonogram of the heart is taken. And this is painless and often is the preliminary diagnosis by estimating the pressure of the right heart and assessing the function of other heart conditions. Estimating the pressure in the right heart and assessing the function of other heart conditions that can produce the same type of symptoms similar to pH can be diagnosed with this echo. And it can also be used to monitor the condition. So with Nicole, this was her initial diagnosis. She had echo. They initially diagnosed Nicole with her congenital heart defects because the holes in her heart were detected through an echo. They detected the Eisenmenger syndrome, and they also detected the pulmonary hypertension because of the pressures in her lungs. And she also gets an echo once a year to keep an eye on the pressures to make sure they stay stable. The next test could be a PFT, which is a pulmonary function test. And this measures how much air your lungs can hold and how much air moves in and out, and the lungs' ability to exchange oxygen. These can be performed to potentially ID its cause. Then there's the exercise tolerance test, which is the dreaded 6-minute walk. And basically, this is what it is. So Nicole goes to see her pH specialist, and they're going to do the 6-minute walk. So they put a headband around Nicole's head and with a pulse ox that will keep track of the oxygen levels in her blood. She will have her oxygen machine, and they will also, I believe, they will also have her hooked up to see what her heart rate is, and then basically she will walk. She will walk the length of the hallway where they tell her to, and she will go back and forth with her oxygen on for 6 minutes. And they will determine how many meters, feet, she walked. And then they will compare that to her last 6-minute walk, which usually she has every 3 months prior to COVID. And they will also do her blood pressure before and after, and then they will look at her how low her oxygen levels went, etc. So that is a 6-minute walk, and as I said, for Nicole, that is done every 3 to 4 months, every time she sees the pH specialist. The next test that could be done is a nuclear scan, which is also known as a VQ scan. And it tests for blood clots by producing a picture of air and blood, producing a picture of air and blood flow to the lungs. A small dose of radioactive material is breathed in, and another small dose is injected via a blood vessel into the lungs. And these images will help the doctor evaluate the health of the lungs. The gold standard for diagnosis of pH is the right heart cath. And this is the most accurate and useful test for a definitive diagnosis of pH. This is the only test that directly measures the pressure inside of the pulmonary artery, and it should be done at least once to confirm diagnosis. Nicole has had, in the last 10 years, she has had a total of 5 heart caths. 2 of them were right-left heart caths, and the rest were just right heart caths. With right-left heart cath, they usually do contrast. And they insert a rubber tube, which is the catheter is inserted into a large vein, which is usually either in the neck or the groin, and it's passed into the heart to measure the blood in the right side of the heart and the lungs. And then the last test, and this is usually, in my experience with Nicole, this is when it was done with Nicole, is during the right heart cath. And that is a vasodilator study. So she had this done with her initial right heart cath that she had on February 2nd, 2010. And it determines how much their pulmonary blood vessels can relax over a brief period of time. And the purpose for this test is to screen for patients who will respond favorably to CCBs, which is calcium channel blockers, which is a form of medication. It can also determine prognosis, and a patient is given drugs that relax the pulmonary arteries, and this drug will be given in higher and higher doses, pausing at each dose to see how the patient reacts. Now, Nicole did not react favorably to this, therefore she doesn't take any CCBs. So there is an overview of the diagnosing tests that are used to get a diagnosis of pulmonary hypertension. So there you go. I hope you all have a wonderful rest of your Thursday, and until tomorrow, take care and God bless.